Do you want to see how I took this crazy looking foot and transformed it to this? Stick around and I'll show you exactly how I did this with making barely an incision on the foot. By now, you know that I am a foot and ankle surgeon and I specialize in minimally invasive foot and ankle surgery. If you're new to this channel, let me explain again what minimally invasive foot and ankle surgery is. So minimally invasive foot and ankle surgery essentially is performing a surgical procedure on the foot and ankle through very, very tiny incisions. They're called keyhole incisions, very small incisions. And the advantage of the keyhole incision versus a traditional incision is that there's a less chance of a lot of bad things happening. There's risks and complications with any surgery, and there's always risks and complications even with minimally invasive surgery in general, but the risks are much less than your open traditional surgery. So let's talk about some of the advantages of minimally invasive foot and ankle surgery. One of the big advantages that most patients love and that I love for my patients is that it's a really tiny incision. Again, these are keyhole incisions. These incisions are so tiny that in some cases, we don't even use sutures to close the skin. In traditional surgery, where the incision is very long, you have to suture the skin in layers. This prevents infection. This prevents any complications that might happen with the skin. Not only does it prevent infections with the small incision, but it's also aesthetically really pleasing for the patient too. There's not a big scar, especially for female patients. There's definitely a cosmetic appeal to foot surgery too, when it comes to bunions and hammer toes specifically. And so being able to correct these deformities with very tiny incisions, so in some cases, patients don't even have scars. It's really amazing what we can do now with minimally invasive foot and ankle surgery. But sort of moving on with some of the advantages, aside from the small scar, there's less chance of infection because the incision is so tiny. You know, when we make this big incision in surgery, what's happening is that the body's exposed to all the germs in the air, you know, and there's germs all over the place. And so when you open the skin up, even when you get a cut on your finger, you're getting germs in your finger, you're getting bacteria, and there's a chance that it can become infected. Now, most of us have very strong immune systems, and so our body is able to fight that off. With a very big incision, there is a chance that the body can become infected. So we minimize that with these really small incisions. The other things that we can minimize is chances of blood clots. Now, typically with bigger incisions, and depending on the procedure that we perform, the patient is going to be off their foot for an extended period of time. Typically though, with minimally invasive foot and ankle surgery, I'm able to weight bear my patient pretty much day one, depending on the procedure. So this means that the patient's getting really healthy blood flow to that limb, and so there's not a lot of downtime. Again, it depends on the procedure itself. But again, we're seeing that there's minimal infection, there's less chance of blood clots setting in, and overall the patient's just much happier. And it's really changed the way I practice surgery in general, specifically with the minimally invasive foot and ankle surgery that I perform. So kind of back to minimally invasive foot and ankle surgery, you're probably wondering, okay, great, sounds awesome. You probably want to learn more about this technique. I love it. It's honestly a fantastic technique. And like I've mentioned in some of my other videos, we're really pushing the boundaries with what we can do. I myself really specialize with bunion and hammer toes, but I've also been able to fix ankle fractures from a minimally invasive approach. Really nice. You know, typically with ankle fractures, you're getting these really big incisions on the side of the ankle. There's chances of, what we call surgical dehiscence. This means that it can be very scary for the patient, and this means that in the post-operative rehab, the skin can pull apart. And now you're dealing with a wound that's there and the chance of an infection, and it can become very disastrous. A lot of bad things can happen, from infection to, loss of limb, loss of life even. Now that's rare, but it can definitely happen, especially with diabetic patients. Diabetic patients, their immune system isn't as strong. And so when you have a big incision, they're very vulnerable. So if we can minimize that incision, do a very good job through very tiny incisions for our patients, they're much happier. They are able to walk almost day one. There's a little chance of infection. It just makes for a much better rehab for the patient in general. Let's go through some examples of some of the minimally invasive foot and ankle cases here. So let's start with this case here. So this is a case where this lady had hammer toes. Now, if you're not familiar with what hammer toes are, it's basically the toe is crooked and it's sort of cocked up. It's almost like, let's pretend my hand right now is your foot. Your toes kind of curl up, and there's different variations of this deformity, but essentially they're called hammer toes. Now, traditionally, hammer toe surgery is performed with a big incision on the toe. We're breaking apart the joint typically, and we're putting an implant inside. Sometimes this implant is exposed. We call these K-wires. These K-wires are exposed, and these wires stay in the foot for 6 to 8 weeks. The great thing about minimally invasive foot and ankle surgery is that oftentimes we're not using pins, we're not using rods, we're not using that type of metal. It's very nice. Specifically, again, when it comes to hammer toe surgery, there's no exposed wires. There's less chance of that infection, and cosmetically, it looks beautiful. So let's look at this hammer toe here. Basically what was done was that we created specific cuts in the bone away from the joints. There's no destruction of the joints whatsoever. We've realigned the toe. We call it rectus position. This basically means it's in more natural, straight position. And the patient walks day one, and there's no exposed wires. Again, there's no big scars. The big thing with hammer toes, typically from an open approach, is that they swell for a very, very long time. The swelling can last 6 weeks, up to 6 months even. Some patients will swallow up to a year, year and a half. It's not unheard of. But with minimally invasive foot and ankle surgery, we're finding that the swelling goes down pretty fast. You will swell, there's some degree of swelling, but the swelling does not last as long typically with minimally invasive foot and ankle surgery. So you can see with this case here, the toes are nice and straight again. The patient was able to walk day one in a post-operative shoe. That's basically just a sandal, as you can see right here on the screen. Okay, let's look at this example here. This example is a bunion. Now, if you're not familiar with what a bunion is basically a bump on the side of the foot and the large toe is crooked. Now, again, there's different severities of this bunion. They come in all shapes and forms, and some patients have different symptoms. Some patients don't have that physical pain. Some patients have more emotional pain. Again, there's a cosmetic approach to this too. Some patients can be very embarrassed with the way their foot looks like. It may not be physically painful, but emotionally it can be very painful. And to me, that is another reason to try and perform this minimally invasive foot and ankle technique on them, to help reduce that bunion, make it look nice and natural, but really to give their confidence back. Now, most patients are going to have some pain with bunions. They're going to be rubbing up against their shoes. They get really hot, red, swollen. Sometimes the big toe will be over so much that they're pushing the other toes over, and the foot looks very deformed. To be able to transform the foot into something more natural, it can be life-changing for the patient. I love that aspect of my job. So again, with this bunion right here, really tiny incisions were used. I was able to reduce the bunion, make it look natural. And again, this patient was able to walk day one in a boot for 2 weeks. They were then transitioned to a post-op shoe, which is basically a little sandal. And then I got them back in their shoe by week 5. They were back to their normal activities, walking daily with their friends, being able to go back to the gym. With this technique, we're able to get patients up and walking much faster than traditional open surgery. Here's an ankle fracture. So typical ankle fractures, very, very large incision. We're putting big plates and screws to hold the fracture in place. And in this case here, I was able to do the same type of procedure through tiny, tiny incisions. I was able to get the fracture reduced, put the proper implant inside the ankle to hold the fracture in place and allow it to heal perfectly. When it comes to ankle fractures, it really just depends on if we can perform this minimally invasive technique. The minimally invasive technique sometimes is reserved for high-risk patients. High-risk patients are typically patients who are elderly, who have other comorbidities like heart problems, patients that may be at risk for anesthesia, patients that are at risk for possible infections. So we want to minimize all that stuff by doing the least amount of incisions on the patient, performing the least amount of incisions on the patient to prevent the bad things from happening. Like I said, infection, surgical dehiscences, blood clots, and what have you. Now, again, with this technique, I was able to get this patient up and walking within 2 weeks, and the patient's doing very well. She's an elderly lady. She told me that it is crucial that she walks as it is part of her daily regimen, and that if she doesn't stay active, then she deteriorates. So it was my goal for her to get her up and walking as soon as possible, but of course it needs to be done in a safe manner. I was able to do that with this technique right here. Even with diabetic patients who have reoccurring ulcerations on their feet from very prominent bones and what have you, I'm able to reduce these bones, offload these ulcers, and allow these patients to heal uneventfully, again with minimal incisions, minimal chance of infection, and just overall happier patients. Last but not least, the foot that I showed you in the beginning of this video, here it is. Pretty crazy, right? So this patient, she had foot surgery by another surgeon in the area, and she had multiple surgeries, and she had very crooked toes, very, very painful. She was at her wit's end. And as you can see, she had previous scars on her foot. And so I reconstructed her foot through the minimally invasive foot and ankle techniques that I just described with keyhole incisions. And so you can see the amazing transformations that we can make, again, with very, very little incisions. I mean, I didn't even use a suture on her foot for this one. And you can see how her toes are looking nice and straight. She's 3 months from surgery now, back to normal shoes, and she's living her life. And if you look at her foot now, you wouldn't even be able to guess that she had a crazy looking foot before this. So, you're probably wondering what else can be done with minimally invasive foot and ankle surgery. Pretty much everything. Everything that can be done from an open surgical approach, we can do from a minimally invasive approach. And that's what I'm doing in my practice right now. Mainly hammer toes, mainly bunions, but I'm able to do major reconstructions, even like flat foot reconstruction. I'm able to do things through a very minimally invasive approach to help my patients realign their arches, even with diabetic patients who have reoccurring ulcerations on their feet from very prominent bones and what have you. I'm able to reduce these bones, offload these ulcers, and allow these patients to heal uneventfully, again, with minimal incisions, minimal chance of infection, and just overall happier patients. And so again, I really love this technique. As you can tell, this is my channel's based on this technique altogether. I encourage you, if you are somebody that has a painful bunion or hammer toe or anything else on the foot for that matter, where you're considering single foot doctor, I encourage you to talk to your surgeon about this minimally invasive technique. If you're in the Detroit area, feel free to come see me. Even if you're not in the Detroit area, give me a phone call. I'd love to talk to you about your problem. We can come up with a solution. I get asked this question a lot: is minimally invasive foot and ankle surgery meant for everybody? I would say that most patients are good candidates, but it just depends. It just depends. I can't give you a complete answer through this video alone. This is a topic that you'd have to have with your surgeon or myself. Most patients are good candidates, but it just depends, again, on the pathology, the degree of pathology, and of course the comfort level of your surgeon as well. I do think that minimally invasive foot and ankle surgery is the future. I mentioned in other videos that it's not even a new technique, actually. It's an older technique that is now starting to become even more popular than before. Even other specialties now are starting to see the advantage of minimally invasive surgery. Again, kind of just to highlight what I mentioned before about the advantages: small incisions, meaning it's cosmetically pleasing to the eye, less chance of infection because of the small incision, and because we're able to get you up and walking faster than typical incisions and typical procedures, there's less chance of even a blood clot. I hope this helps. Please subscribe, comment for any questions that you may have, like and subscribe, follow my Instagram page, follow my Facebook page, and I look forward to seeing you guys in the next video. Thanks.